While cancer patients at Kolebu Teaching Hospital are facing extended delays and suspended appointments as the hospital's only radiotherapy machine is unable to cope with the rising demand. The machine, which has experienced frequent breakdown, was recently repaired but continues to operate at a reduced capacity, limiting the number of daily treatment sessions. Well, Rejoice Semipakpeso has been to the hospital's oncology department. She filed this report.
8-year-old Joshua is having one of his 33 sessions for the treatment of cancer.
Pain. I feel pain.
What do you want to become? You told me you love John Mahama. You can give a shout out to John Mahama. Anything you want to say to him?
President John Mahama, please, can you help me with my treatment, please?
You are hoping to get back to school soon. Okay. You're hoping to get back to school?
Yes, of course. Yes, of course.
He's one of the lucky few, as many have been told to hold on with their treatment. Appointments for patients requiring more than 6 treatment sessions remain suspended as oncologists at the hospital await comprehensive maintenance on the radiotherapy machine, which is currently operational but limited to just 10 sessions per day.
The engineers posted here by the company, the local agents, did work. They worked on the machine. They worked on the machine, and somehow they were able to get it back online. But they realized that when it stays on for a few hours, then the problem resurfaces. So then management has taken a decision that we are treating, as a stopgap measure, we are treating patients who have about 5 to 10 treatments left, right?
Professor Joel Yane is head of oncology department at the hospital.
We should pay attention to non-communicable disease and cancer in particular. Yes, because our disease profile is changing. It's not only in Ghana, most developing countries, the disease profile is changing. They're having more non-communicable disease, more cancers. And radiotherapy plays a very important role in the management of cancer.
On the 4th of July 2024, patients arriving for the scheduled treatment were turned away as oncologists at the Kolebu Teaching Hospital scrambled to bring engineers to repair the only radiotherapy machine, which had broken down due to excessive use. Some patients were worried.
I was scheduled for radiation treatment, which will take 16 working days. But I realized that they were having issues with their machine. I was scheduled last week, Thursday. I did a Thursday and Friday, and I'm supposed to continue from Monday up to date. After those 2 treatments that I had, I've never had any.
This incident occurred just days after oncologists at the Kofonochi Teaching Hospital withdrew their services in protest over delays in repairing the cancer treatment machine at their facility.
It is unfortunate that our colleagues, a section of our colleagues in oncology, have taken this action.
Professor Yane, having experienced the pain patients are going through, wants government to bring in more machines.
Government is aware, and there's a master plan. Yeah, there's a master plan. The plan is to associate, because it's very complex and cancer management is quite complex, we associate it with the teaching hospitals. So the plan we have now is to have one in Tamale, one in Cape Coast, and one in Ho, because they have medical schools, and therefore we'll have the human resource. People who do some cancer work, right? So these will be new centers. Then Kofonochi and Kolebu will have additional machines, so they will have 2 each, so that when such a problem arises, we can solve it. Unfortunately, we have not been able to implement our plan. Mind you, I told you that the machine costs getting to about $2 million.
Rejoice Semifakbasu's report for Joy News.
Let's go on the phone lines now and speak to Dr. Mark Kett, his Deputy Ranking Member on Parliament's Health Committee. Thank you for your time here on Newsdesk. Worrying story there. Has this issue been brought to your attention?
Good morning to the viewers of Joy TV. And I wish to say that it's not unfortunate, that this has occurred, and we are also reading it in the news, like probably most Ghanaians are doing, as a committee. Well, the issue is that as a country, like the head of the oncology department said, our NCDs, that is the non-communicable disease burden, is on the ascendancy, practically reaching about 40% in terms of probably the cause of mortality and morbidity in the country. And I must say that as a country, we now need to prioritize very well. I don't want to believe that it is the lack of resources that is making us to have only 2 of such machines in the country. That is one at Kolebu and one at Konfanochi. No, that is not the case. And with a very high burden of about 60 cases or more a day, of people reporting to assess radiotherapy. And we know the importance of radiotherapy. We don't have to explain this. Once you have cancer, which hitherto was practically also thought to be uncurable, if you start a treatment, for example, you could start with treatment that is surgery, and after the surgical removal, the surgical removal of the organ, you still need to undergo further treatment, because when let's say the breast is, if it is breast cancer and the breast is removed, that doesn't mean that all the cells with the cancer has been removed. It is possible that some is left there, or some of the tissue is left there. Or it is also possible that it has spread to nearby organs, like the chest, the lungs, for example. That's what we call the metastasis. And when that happens, then we need to follow it up with what we call the chemotherapy and then the radiotherapy. And so practically, in our country here, where presentation of these sicknesses or this cancer is usually very, very late, most cases will end up undergoing either the chemotherapy or the radiation therapy, or even a combination of both. And so we simply have to prioritize. I don't believe that it is a lack of resources. The government has to prioritize. The government has to take the right decisions and make sure that we have these machines all over. Like he said, there's a master plan, but nobody is following it because probably they don't. In fact, I want to blame both politicians and technocrats in the country. Most often when decisions are taken, it appears that there are some people who always want to ask, this decision that we are taking, what am I going to get out of it? Let me just, as an individual, that is the thing. Not what the nation is going to get out of it, but as an individual, what am I going to get out of it? And that is leading us to waste a lot of resources in other areas and not in hot matters.
You're a deputy ranking member on Parliament's Health Committee. Do you expect this issue to be raised on the floor?
Yeah, I mean, it's practically getting to a month now, if not more. And now that it has come to our notice, we should be using one of our tools to ensure that we get this issue raised. Because like I'm saying, it is the lack of prioritization of what we need that is causing this. We are ready to build new hospitals here and there, Agenda 111. But it is not the buildings that make up a hospital. I always say that, look, this Agenda 111, which we have spent up to 3 billion or more on it, 3 billion Ghana cedis or more on it, couldn't we have used some of these resources to build or purchase some equipment which will be serving Ghana now than the Agenda 111, which has been spread all over the country, and I'm afraid probably not a single one might be commissioned before the end of the year.
How soon do we expect you to raise this issue on the floor?
Today is Friday. If possible, it will come. If not, then early next week, we should have prepared and officially raise the issue and probably even invite the Minister of Health to come to the floor of Parliament and explain what is happening. Repairs and it breaks down. Repairs and it breaks down. Obviously, it will break down. We know, because if you are getting 60 patients a day to use a single machine, that is too much. I mean, even human beings will break down. How much more machines?
Thank you so much, Dr. Marquette, for your time here on Newsdesk. His Deputy Ranking Member on Parliament's Health Committee, assuring that this issue will be raised in the House and, if possible, the Health Minister summoned to provide answers to the questions boggling your mind. Well,